of complementary medicine, the role of complementary medicine in dealing with challenges in the treatment and management of disease condition. We are looking at the overwhelming benefits of Superlife Terahertz electromagnetic radiation therapy, the Hertz Terra device. We are looking at the overwhelming effects, the overwhelming benefits in health industry, in Superlife industry, and the industry at large for mankind. So why we are saying dealing with the challenges, because there are challenges with orthodox medicine. There are challenges with orthodox treatments, and there are challenges with other, devices that have been, made for, therapeutic purposes, acupuncture purpose, massaging purpose. But those ones, they don't have the uniqueness of the Superlife Terahertz device. So that is why this one is very, very important. So it has helped, and it is still helping to deal with the challenges those ones have faced, challenges drug have faced, challenges other devices that you saw before this time have faced. This one has come to eradicate those challenges. So it's very, very much important and has overwhelming health benefits. So today, we're looking at the Superlife Terahertz device. Now, the Superlife Terahertz device is not a diagnostic device. The Superlife Terahertz device is not a diagnostic device, as I used to say, but it's a therapeutic device. It's a therapeutic device. It's a device with high prognostic value, a device with high medical importance, device that confers wellness, device that confers well-being. It's a device for prevention, a device for prophylaxis, device for healing, device for management, device for treatment. So that is why it's very, very much unique. So why I say it's not diagnostic, it's not like X-ray machine. Even when it has some unique nature, the operational mechanism of X-ray device, it's not MRI, magnetic resonance machine. But even when it has some unique nature, like the magnetic resonance imaging device, so we don't use it to diagnose a condition, but we use it to treat a condition. And I think the bottom line in wellness and health industry is to get solution to any underlying problem. If there is a disease, what is much more important is how the disease can be gotten rid of. Good, how to identify the disease, yes, is good. But what much more important is how the disease can be gotten rid of, how the disease can be managed, how the disease can be treated. So that is where this Superlife Terahertz device falls into, getting rid of, managing, bringing solution to disease condition. So that is why it's much more unique. Now, having known that it is not an electromagnetic, it's not a diagnostic device, it is also an electromagnetic device. Superlife Terahertz radiation device is an electromagnetic device. Remember, we have the electromagnetic spectrum. Now, in the electromagnetic spectrum, we have radio waves. That is the one that is used for MRI device. The one that is used for MRI machine. Radio waves is in the electromagnetic spectrum. X-ray, the one that is used, the model that is used in X-ray machine, is in the electromagnetic spectrum. Ultraviolet ray from the sun direct is in the electromagnetic spectrum. Infrared ray is in the electromagnetic spectrum. Visible ray is the electromagnetic spectrum. Gamma rays, the one that is used for nuclear reactor, or the one that is used in radionuclear devices for treating cancer. So when you are talking about, say somebody is going for chemo and somebody is going for radio, so radiotherapy. So that is therapy, they use gamma ray. There are some areas that use gamma ray. So that gamma ray is also in the electromagnetic spectrum. Now, Superlife Teraheartz, that word terahertz is the electromagnetic radiation, is also in the electromagnetic spectrum. It is sandwiched between ultraviolet ray and infrared ray. That is where terahertz radiation falls into. So in the electromagnetic spectrum, you see terahertz, which Superlife has incorporated into a device, is in between ultraviolet and infrared, but it's closer more to infrared. Now that is why I say it's a unique device. So unlike the previous ones that you have been seeing, those that are doing massage, that do acupuncture, naturopathic treatment or management, they were using devices that were not having electromagnetic basis. So this one has an electromagnetic base. And so you see how important this Superlife Terra has. So we should be very mindful of that word, Terra. When we say Terra, that Terra, the full meaning is terahertz. And the terahertz is the frequency. Is the frequency with which that device operates. And that frequency, as I'm telling you now, is in the electromagnetic spectrum. So for any device to have an electromagnetic spectrum property, that device is unique. That device is unbeatable. That device is second to none. So that is how that device is. Now, Superlife haven't come down. They have made this device using electromagnetic radiation called terahertz. Now, this device was made based on three principles. So Superlife came together, to design it using three principles. You see, I've always said Superlife products are always divinely produced, divinely organized, divinely sought out. Because if you watch their products, starting from stem cell ST30 through SNC, through SCC Plus, through SIC, through Super Root Coffee, through Super Tech, you see that the components, the ingredients, it's not what you just sit down and start thinking, okay, what do we put together? It is more than that. So that is why the products are so powerful, medically, so powerful in all ways you think about it. Now you see that they have produced an electromagnetic device, but in producing this electromagnetic device of the order of a terahertz device, they still applied or put together three important principles. So what are these three principles on which this terahertz device was constructed or was made or was designed? One of the principles is quantum energy principle. Quantum energy principle. That is one of the principles. The second principle is optical quartz principle. Optical quartz principle. That is the second principle. Then the third principle is the terahertz itself. Terahertz technology. Terahertz technology. So you see, they put together three technologies. I mention it again. Quantum energy technology, optical quartz technology, and terahertz technology. So those are the three technologies they put together in designing this terahertz device. Now we talk of the first technology. The first technology is quantum energy technology. Quantum energy is energy released in discrete packets. It is a packet of energy. It's not just a single energy. It's a packets of energy. It's a quantum form of energy in the form of mass. So, and that energy is derived, it works on the principle of quantum mechanics in physics. There are many scientists that use quantum mechanics in designing many electrical devices, many physical devices that was used in olden days and modern day physics. So that is the same principle That's a quantum energy principle. So that means the energy that comes out of that device you are holding as terahertz device is in the form of quantum energy. It's in the form of packets of energy. It is called of mass of energy. So that's why you are not surprised when the energy goes in, it produces a result because it's a packet of energy, not just single energy, not just energy of one dimension. It's energy programmed into a mass and having low energy frequency and having long wavelength. So you see, the energy that is used by this device, terahertz device, is low energy, quantum energy. Low energy in the sense that it has low frequency, but it has long wavelength. So it comes in form of mass. So that was a basic principle which Superlife adopted to produce that energy. So you see, the way you direct it, as it comes out in the form of a blower into any parts of the body, you see the way it comes out. That force which comes, that is a quantum. It comes out in that discrete packets of energy. So that is one of the principles. Now, the second principle, or second technology that was used in designing the Superlife Terra device is the optical quartz technology. Now, optical quartz is very, very rare. Optical quartz is a form of crystals. Optical quartz are, crystalline materials that have very unique property that finds usefulness in electrical use, industrial use, and in the health industry use. So, having seen that optical quartz can be used in health industry devices, communication devices, electrical devices, Superlife was able to harness it in producing this Superlife Terra. So optical quartz is a very durable, persistent, crystallographic substance that they use in constructing that device. So if you look at that device very well, look at the physical structure, look at the place where you put the on and on button, you see the design inside and outside. You see they were made with optical quartz crystals or crystalline materials. Now, why did Superlife choose to use optical quartz? You see, that's where we now come to the divine attribute in their product that I've always given to them or I've always ascribed them to be. Why now did they use, optical quartz material? Now, look at it. One, why they use optical quartz material? There are several characteristics of, biological properties of high importance of this optical quartz material. One of them, why Superlife used them, is optical quartz has high electrical resistance. Has high electrical resistance. In other words, when you are using that Superlife Terra device, you plug it to source of light, whether the light is from alternating current, that is NEPA, or the light is from, or the current is from, direct current, that is the generator. As long as once you plug that device on the socket and you put it on and voltage is transmitted, when the device is being operated, it does not have any issue of electrical interference. Say the voltage is too much and it not destroy the property. The voltage is too much, something not born inside. Like you see the way some electrical appliances behave. Say, this voltage is too much, so it will destroy something inside. No, because that optical quartz resists electrical interferences. So if suddenly there's increase in voltage, because our nature of our electricity, or there's reduction in voltage, or there's interference in your direct current, maybe you're using gen, it does not affect that Superlife Terra device, because the optical quartz in it makes it to resist electrical interferences. So that's why we say it has high electrical resistance. Then two, another property why it was used, it has high thermal resistance. You know, there are some devices, when you are using them, over time, heat will be developed. And when heat is developed, the device goes off, or the device begin to function beyond capacity, or begin to function less than performance rate. So, but this one is not like that. So the optical quartz has high thermal resistance, can resist heat generated by electrical source, generated by any source through which that device is being operated. So you can see, so that is why that device can be used for several hours and the device is working perfectly continuously because it resists heat or thermal interferences. I see how important that Superlife Terra device is. Then not only that, the device is durable. The device is portable. Superlife Terra device, the way it was designed, you can just travel with it. You can go to anywhere with it. You can go from market to market, from street to street, to using it on people. You can easily carry it. So it's not a bulky material. So because the design has made it so durable and portable. So that is one of the techniques with which they design. So if they had made it bulkier than that, so it would be difficult to use it in some places. So you can carry it along, traveling document as a traveling luggage or part of your luggage. So you see, that is another importance of that terahertz optical quartz substances or crystalline substance that was used in construction terahertz device. You know, that device also, that optical quartz also help you to resist, chemical interferences or solutions of, solutions that are in form of chemicals. You know, if by one way or the other, the Superlife Terra device force into water, that, optical quartz make it waterproof. So water will not be able to penetrate inside. And even if it finds a way of getting inside, the optical quartz with which it was made also resists solutions like water, resists even solutions, acidic solutions, except the ones that just consume the physical body, but the operational dynamics inside will still be working. So you see how resistive and powerful the terahertz device is because of that optical quartz. Now, another property or characteristics of that optical quartz with which that device was made is a property of birefringence. Birefringence means it can transmit light to go to two directions. A single light that was coming, a single ray of light that is coming, as it penetrates, it can be diverted into two or more directions. So you see that when you beam that device into the body, the way it comes, that blue light that comes out of the device, that accompanies the terahertz radiation, when it penetrates the skin, when it penetrates, you see it is polarized to go straight one direction where you focus it on. And that polarization goes with the quantum mass and quantum energy and characteristics frequency with which it carries and the wavelength. Are you seeing it? So that birefringence property, which only properties like properties like what do you call it, optical quartz can do, makes that Superlife Terra very, very, very unique. Now, that optical quartz also have low thermal expansion. Another unique property, low thermal expansion. Let me tell you something. You see, if there are some electrical materials when you are using them, as a result of the effect of electricity on heat, or electricity can generate heat. So when the electrical input will generate heat in that device, that heat will interfere with that device. First of all, we have said optical quartz resist heat, but apart from that, some devices have materials that expand. So when heat comes, the materials expand, and that expansion will break in the contact in that material, and will stop the function or stop working at that point. For example, let me give you a simple analogy. The electrical ion. The electric ion has what we call bimetallic strip. Bimetallic strip are what we naturally call elements. We say they go and change the elements in the ion. So the bimetallic strip are what we call elements. So when the ion is working, there's a time you see the ion will just switch off. It will just cut off. Within some seconds, it will trip on again. Are you getting it? So that time that it cut off, the bimetallic strip expanded because of the influence of heat. So as expanded, it cut off the working mechanism. Are you seeing it? Because it can expand. But optical quartz does not expand. So it has low thermal expansion. That is expansion caused by heat, caused by electrical heating effect. So it does not expand. So that is why you see the Superlife Terahertz device does not just cut off. It only switches off at the program time. If it is programmed for 10 minutes or you program it for 20 minutes, it will cut off at that 20 minutes or at that 10 minutes. And that is why it operates on what we call post frequency or post wave frequency. Post wave means when it gets to that program time, the wave that generates or that the wave through which the energy is being propelled will cut off because it has got to the program time where that wave, where that frequency will operate. So when it gets to that frequency, the cut off by itself. It being used, no, because it has low thermal expansion. So you see how powerful that Superlife Terra has device is because of what? The optical quartz with which it was made. Now we have just talked about the second technology. Now the third technology is the terahertz itself. So now the terahertz, as I told you before from initial, that it is an electromagnetic radiation. It's an electromagnetic ray. It's an electromagnetic wave. Tera. The full meaning is terahertz. Terahertz is a frequency. Just as you have X-ray, it's a frequency. Just as you have radio waves, it's also a frequency. Just as you have ultraviolet ray, it's also a frequency. Just as you have infrared ray, it's also a frequency. Just as you have visible ray, it's also a frequency. Just as you have gamma ray, it's also a frequency. Now, each frequency has a known wavelength with which it operates. So our terahertz has low frequency, but it has very long wavelength. Are you seeing it? It has low frequency and has long wavelength. Now, the only device that has long wavelength used in the health industry as diagnostic device is MRI machine. MRI machine. You know, MRI, that is the device that is used for conducting MRI, magnetic resonance imaging. That device uses radio frequency that has low energy but has high wavelength or long wavelength. You see, that is why if you are placed in a magnetic resonance imaging machine, you can stay long. They can allow you to stay even longer time than in X-ray, because X-ray has very high frequency and short wavelength. So high frequency and short wavelength. So if you use X-ray to take photograph of the chest, take photograph of the bone, because of its high frequency, you want to get a picture, a direct picture of where you are, where you want. But if the where you are, the fault or where you are trying to diagnose is inner and inner, the X-ray may not be able to get it because of its short wavelength. Now, that is why they will now refer you to use MRI. The MRI, why they say you use MRI? Because it has long wavelength. So that is why if you want to get deeper parts of the body, nerves, inner part of the body that cannot be ordinarily pictured by X-ray, cannot be only pictured by CT scan, they will not tell you use MRI. Why? It has long wavelength that can penetrate deep inside the body. That is what Superlife Terra has have. That Terra has radiation has long wavelength, almost radio frequency of So you see how unique that device, that radiation, that terahertz radiation, trace deep into the skin, pass through the epidermis, goes through the dermis, goes to the subcutaneous fatty level, gets to the bone marrow. So you see why it's able to activate nerve function, nerve action, nerve functionality is because it penetrates deep by reason of its long wavelength. So you can see how the principles Superlife have put together, the technology they have put together to produce this device. The one I've mentioned, quantum energy technology, I've explained that. Second, I've explained optical quartz technology. Now I'm not explaining terahertz technology, that it has, minimum low energy, low frequency, but very long wavelength. So the long wavelength gives us that therapeutic value of penetrating deep to any part of the body on which it is beamed. And that guarantees us, a very prognostic result, a very good outcome, because it goes deep to give us result. So those were the three technologies that Superlife put together to produce this terahertz device. Now, we now go to what are the working mechanisms? What are the mechanisms? The topic we did is overwhelming benefits of Superlife Terahertz electromagnetic radiation device. So, what are the working mechanisms with which this device, creates and does, better things that which other device have not done before? What are the working dynamics? What are the working mechanisms, that guarantees its efficacy when used on any disease condition? Now, we are going to start like this. The body has dielectric property. Our human body has dielectric property. What is dielectric property? The body has various degree of permittivity and conductivity. When you say various degree of permittivity and conductivity, if you hold a bare electric wire and it is on electric source, it will shock. It will lead to electrocution because the body allows passage of electricity. So the body allows passage of electricity, passage of heat, passage of substances. So that is why we say the body allows some degrees of permittivity. The blood conducts. Our blood can conduct electricity. That's why electricity can pass through it and shock us. Our blood can conduct it and heat pass through it and we feel it. So you see, so the body, because the body has levels of permittivity, levels of conductivity, we say it has dielectric property. And since the body has dielectric property, when Superlife Terahertz is beamed on it, the body allows the passage of the Superlife Terahertz device, that electromagnetic radiation, which is the terahertz, the body allows it because it permits entrance of substances. So that radiation, which is the terahertz, goes in. So our cells, our tissues, our organs, our the blood or plasma or water content of the body allows the passage of it. So if blood allows the passage of it, if water allows the passage of it, if cells allows the passage of it, if tissues allow the passage of it, if organs allow the passage of it, the entire system allow the passage of it. So it will provoke a therapeutic or healing outcome in the body, because the body allows it. So one of the basic mechanism of action is the Superlife Terra device takes advantage of the body's dielectric nature for allowing passage of rays, like electromagnetic ray, like this type. So you see it. Now, secondly, our cells allow the passage of ray. That is why you see, they'll tell you there are some countries you go to, they say the ultraviolet ray that is coming from the sun is too much. Even in Nigeria, there are seasons where the sun, the heat from the sun, the ultraviolet ray is too much, that you have to shield yourself, hide away from the sun, because your body permits the entrance of ray. The cells permit entrance of ray. So sometimes those ultraviolet ray, those infrared ray, why it is not used in most health devices, because it can cause a skin burn, it can result in skin sore, skin bump, or skin cancer. But this one, Superlife Terra has a device which produces terahertz frequency radiation. It does not cause skin burn because the energy is minimal. The energy is low. The frequency is low. So it will not cause skin burn. So the body permits it. The cells permits it. The tissue permits it. Are you getting it? So because the tissue permits it, the cells permits it. So it is a good advantage of a good healing advantage. Now, secondly, the body fluids, the major body fluids, you have water. The major body fluids, you have nutrients in form of solution. The major body fluids, you have blood. The major body fluid, you have plasma, which is part of blood. They allow the passage of electromagnetic radiation, like terahertz. So since they allow the passage of electromagnetic radiation, it finds use. It finds, diagnostic, therapeutic value when it comes into our system. Now, let's start with the cell. Now, when you beam this Superlife radiation or device on the skin or any parts of the body that is diseased, now it goes straight to, it penetrates through the epidermal layer, goes through the dermal layer, and goes to the subcutaneous, as far as the subcutaneous layer. Now it gets to the cells. When it gets to the cells, what does it do? When it gets to the cell, it elicits cytoplasmic and endoplasmic, movement. Let me tell you why cells do not function very well. When what is supposed to go into the cell does not go in, and what is supposed to go out of the cell does not go out, the cell will not be functioning well. The cell will be dormant. The cell will be under functioning. I see. So that is some of the problem, that when a cell is already having that, defect, in not being able to, allow in the passage and excrete and allow out the passage of substances, nutrients, even in form of nutrient, in form of ions, nutrient in form of minerals, nutrient in form of oxygen, nutrient in form of proteins and bioactive molecules. They cannot go into the cell. They cannot come out of the cell. The cell will be, stalled and stuck, and before you know, the cell will be diseased. And once the cell is diseased, it transmits to the tissues. Are you seeing it? So when Superlife terahertz enter, that terahertz, that radiation, what it does, it provokes or facilitates the cytoplasmic movement. It makes substance that will go in, nutrients that were stuck in that could not go in, to push them into the cell. And when it does that, the one that is supposed to come out of the cell, it pushes them out of the cell. And when it's doing that, it is facilitating cytoplasmic movement, protoplasmic movement, and endoplasmic movement. And when there's that movement, that means there will not be perfect communication between the cells and its environment. And when there's perfect communication between the cells and its environment, the cells will be active. Now, apart from that, when it does that movement, active molecules are not in the cell now does cell function, cell communication, cell survival. Are you seeing it? Because what is supposed to go into the cell has gone there. What is supposed to go into the tissue has gone there. What is supposed to go out has come out. Are you seeing it? So there are substances within which the cell, by action, as the cell is doing its work, it produces radicals. Those radicals are radicals that causes, oxidative stress, because the radicals, they are unstable. Because they are unstable, so they tend to cause oxidative stress, resulting in overwhelming our body antioxidant. So as a result of that, it will start destroying the cells. Now, when Superlife Terra has find itself into the cell, those substances, that are free radicals that are unstable, it provokes addition of electron, because as it passes through the cell, it provokes free electrons. It adds them to those substances that are unstable. Of course, when they receive electrons, they become stable. And when they become stable, the oxidative stress goes away. And when it does that, it will empower our antioxidant, to mop up those, radicals that were supposed to destroy the cell. Are you seeing it? So when it is doing this function, it is doing it. If the cell is already diseased now, as it goes in, it will help revitalize that cell. It will help that cell to function. And when it's helping the cell to function, then the tissue which the cell combined together to form will also be functioning. Now, as it's doing that, getting the cell back to life, it's also preventing other likely events that would have happened because of the cell failure. So it will now prevent it. Are you seeing it? So that is the advantage I said by our cell allowing it. Now, we know that Superlife Terra radiation is highly absorbed by water. It's highly absorbed by water. Are you there? It's highly absorbed by water. I hope if you are hearing me, let's respond. Superlife. Superlife.
Life is super.
Life is super.
So okay, so that means you are hearing me. You are hearing me. That's good.
Yeah, okay. Loud and clear.
Yeah.
Okay, that's wonderful. So our cells are made up of the cytoplasm are made up of water. So human cells are made up of 70 to 80 to 85% water. Are you getting it? Now, since Superlife Terra has radiation is highly absorbed by water, so when it penetrates into the skin and goes to the cell, because this cell contains water, it absorbs the radiation fast. So one of the fastest way with which it goes, our terahertz enters cells that are abnormal, cells that are not functioning very well, is because the water that the cell contains absorbs the radiation so fast. So that absorption quickens the entrance of Superlife Terra. And when that radiation enters, it now does immune modulation. It modulates the immune system. What is immune modulation? When there's immune compromise, that is where disease comes. Because failure of cells is a result of discommunication in the immune response system. So when Superlife Terra enter, it does immune modulation. That immune modulation, it separates the cells from immune disconnect and rejig the immune system so that the cell will not be having perfect communication with the immune system. And when the cell is having perfect communication with the immune system, the cells come back to life. And the immune system will be able to provoke or provide a good response system. Once a good response system, if there's a disease condition, the body is supposed to provide an immune response or providing an antidote to that disease agent. Are you getting it? So it is only when the immune system is active that the body is able to respond by producing an active immune response system. So this Terra has helped to rejig a failed immune network system. So and help to provide a better immune response. So are you seeing it? So that is how powerful. And when there is a better immune response, there's better nerve function. Nerve function better when the immune environment is active, when there's a better immune response or environmental response system within the cell. So as I've said before, the water present in our cell facilitates the entrance of terahertz radiation. So when it goes to cell, it enters fast because of the water in cells. Now, let me tell you, the cells of the brain and the cells of the kidney, the cells of the brain and the cells of the kidney has the largest water content. So if you don't know before, know this, that the brain cells, the kidney cells, has larger water content than lungs, than heart, than liver, than skin. Are you seeing it? So that is why we guarantee the use of terahertz in the brain, on the head. We guarantee the use of terahertz at the middle back where you have the kidney. Are you getting it? We guarantee the use there because there the cells there are, they're highly hydrated, have large water content, and we have known now that Superlife Terra is highly absorbed by water. So suffice to say that a kidney condition, kidney disease, when we beam it at that middle back there, at the back there, where the kidney is, the two sides of the spine, right kidney and the left kidney, we beam it there. It goes straight, it's able to penetrate because the cells of the kidney has more water content that guarantees the entrance of it. So when we are treating kidney disease, Superlife Terra has device highly recommended. When we are dealing with hair, brain dysfunction, brain problem, Alzheimer's, Parkinson's, and hypertension, we also beam Superlife product, Superlife Terra has on the brain, because the brain cells are full of water than every other parts of the body. So are you seeing some of the basic principles with which of working mechanism with which this Superlife Terahertz device operates? So I just told you about the advantage of water present in our cells that guarantees the entrance of the Terahertz device. Now, you know, the skin has large concentration of nerves. The forehead has large concentration of nerves, and the fingers, tip of the fingers, and the tip of the toes. That's have large concentration of nerve cells. So are you seeing it? So when the Superlife word says this thing should be used on different meridian points, you know, the word meridian points is basically in Asia Medical Journal. You know, the Asians, they are good at acupunctural medicine. They are good at naturopathic medicine. They are good at, divisional medicine and functional medicine. Why is that every part of the body has latitude and longitudes of nerve cells. So nerve cells cross from east to west part of the body. Nerve cells cross from north to south part of the body. That is from head to toe, from the left hand to the right hand. Are you seeing it? That's latitudinally and longitudinally. That's how nerve cells are networked. So the Asians tag those points, those different places where you have nerve cell connect, nerve cell junction, they tag it as meridian points. So they say there are meridian points here all over the skin. And apart from the Asians saying it, we are telling you by medical emphasis that the skin has large network of nerve cells. So you now see that when you use Superlife Terahertz product on all the meridian points that were mentioned, the head, the shoulder, the back, the tip of the finger, the lower waist, the lower back, the thigh, every meridian point that have been mentioned, you are trying to galvanize. We're trying to galvanize a holistic immune system response for the person for complete wellness and wholeness. Because as you use it on this different meridian point, you are able to highlight the nerve cells there. You are able to make them proact them into action. And when the nerve cells are active, of course, circulation, microcirculation, whether through blood or macro circulation, whether a combination of lymphatic and circulatory blood circulation, you're able to galvanize them into action. When there's perfect circulation, micro circulation, macro circulation, lymphatic circulation, of course, diseases that are linked to circulation defect will be off. So the device, that means our Terahertz device, is also for prevention, apart from treatment. It's also for prevention. So when you use it, when there is no problem, there's no underlying problem, you are trying to prevent future problems. Because if the cells they are prone to inflammation, as you are using it, this device is anti-inflammatory. This Terahertz device is anti-inflammatory. Yes, because when it goes through the skin and goes to the cells, what it does that it inhibits pro-inflammatory cytokines. That's what we call cytokines or interleukins, or other we call them inflammatory factors. They make the cells of the body to suffer inflammation. And when there is inflammation, disease emerge. So now, when Superlife Terahertz goes in, that radiation, when it goes in, it inhibits the action of pro-inflammatory cytokine. When it inhibits the action of pro-inflammatory, that when you say pro-inflammatory, that what supports inflammation, it inhibits the action of that. And when it inhibits pro-inflammatory cytokine, in other words, it prevents inflammation. And when it prevents inflammation, it prevents disease emergence. When it prevents disease emergence, the person is okay and normal. So if there is already inflammation, as it goes in, it deactivates the inflammation, it knocks off the inflammation and prevents further inflammation. So when it prevents further inflammation, it will not guarantee wellness, not guarantee management, not guarantee treatment. Are you getting to where there's already inflammation? So it does two-way thing, prevent inflammation and reverse inflammation. So that is what the Terahertz device does when it goes in that beam of light, which we are seeing there, that beam of radiation, which we are seeing there, that is the Terahertz radiation. Are you seeing it? So that is one of the basic fundamental mechanisms with which this device is being, beneficial to our body. Are you getting it? Now, another area I want to look at is the combinational use of this Superlife device, Terahertz device, and our existing Superlife product. So we have seen that the combination of Superlife existing product like ST30, SNC, SIC, SCC Plus, SROC, SCT, that's Supersetec, and Superlife Terahertz, the combination will bring one holistic result. Apart from holistic result, it will reduce the turnaround time. When I say reduce the turnaround time, our prescription, we normally start prescription of 90 days prescription. So we can take Superlife ST30 for 90 days. Then we'll check the outcome. Then we'll not know what to do from henceforth. So, but when you combine the Superlife ST30, for example, and Superlife Terahertz radiation, it will not get to the 90 days before it gets the result. So it will reduce that turnaround time. Eventually, you might get the result at the end of 1 month. You might get the result before the end of 1 month. You can get the result after 1 month. So you see the advantage of using it. So though we have exclusive use of the Terahertz device, only where the Terahertz device can be used. Yes, areas of pains where you say you have muscular pain, musculoskeletal pains, which we know is the nerve that is resulting in it. When you beam Superlife Terahertz device on that place twice daily, before you do it for a month, you see a fantastic result. It will get rid of it. So, but when there are remarkable disease conditions, we're talking of liver parenchyma disease. We are talking of kidney parenchyma disease. We are talking of lung fibrosis. We are talking of cancer management. We are talking of other disease conditions. You combine them. Now you see, as I just told you, the combinational therapy. So it is good in this disease condition. You can combine our Terahertz device and existing Superlife product. Now, I told a neurosurgeon that he was asking what are the indications of this Superlife Terahertz device. I spoke to him and I explained to him, look at the advantages and look at the importance of this device. He now said, can this device treat cancer? I said, yes. It can help in management of cancer. I said, of course, there's no permanent treatment where you say this one treat cancer. This one, the only permanent eradication of cancer is the beginning of cancer, the early detection of cancer. And so removing of that particular cancerous part of the body or the cells or the tissue will help in the management. Removing that particular tumor that is already cancerous, but it is localized, will help eradicate the cancer permanently. So when the cancer has already established itself, what you will now have to do is to minimize the effect. What you now have to do is to stop the spread. What you now have to do is to stop the proliferation, to stop the differentiation, to arrest the cell cycle of the cancer cells. Once you do that, the person will be living a normal life. So that's why you can see, say this, somebody will say, I'm 10 years cancer survivor. I am 7 years cancer survivor. That's I've been with cancer for the past 7 years. I'm still alive. It's because the cells are not proliferating again. This has been stored so that, because if there's complete in the cell cycle, it will result in proliferation, differentiation, and neoplasmic transformation. So now, Superlife Terra, I was telling him now, Superlife Terra can help. He said, how does it help? I said, and I told him, sir, do you know that cancer cells has more water content than any other cells? He was saying, okay. I said, not okay, that is it. Cancer cells has more water content than any other normal cells. So when a cell is cancerous, it has the percentage of water the cells that contain becomes almost 2 times higher than when the cell was not cancerous. And you know, our terahertz electromagnetic radiation is highly absorbed by water. So when it's beamed through the system and it finds way to where cancer cell is, because cancer cell has large amount of water, so the absorption rate of the radiation will be faster and higher. So that means you now have large quantum energy terahertz radiation in the cancer cells. And when it goes there, what it does, it now provoke the natural killer cells. It provokes, try to stop the cell cycle of the cancer cells. What it does, by the immune modulation, it is trying to prevent differentiation, prevent neoplasmic transformation of other cells that are not cancerous. But the cancer cell can make that to be cancerous. So Superlife Terra can go there. By that is action, it will prevent the neoplasmic transformation of non-cancerous cells into cancerous cells to prevent it. Have you seen it? So other cells now that are preparing to be cancerous, it will stop them. So the man was very, very interested for that. What I explained to him, he has to come to the office. He said he wanted the machine to be used on him. So when the machine was used on him, he was very, very glad. And he said he would go and, use it on, he has a lot of cancer, as a neurosurgeon, he has a lot of cancer patients. So that's why when you combine it now with, Superlife existing product for cancer management, you see you have one, fast recovery rate. You see you have, better holistic result and action. I see that better management. And the person will be leading a normal life. I will tell you, I've been with cancer for the past 6, 7, 8 years. Are you getting it? So that is very important, application of terahertz device. And now we now go to the, operational mechanism, dosage and duration of this Superlife Terahertz device. Now, if you look at the device, it has an on and off button. Now, the device initially has already been programmed on level 1, and the time has been programmed as 10 minutes. So that means when you switch the device on by slightly touching, just place your hand slightly on the on button. When you place your hand, the device will on, and when it starts, the radiation comes out from the under in form of air. So that's why I call it a blower. It comes out as a blower. So and you now focus it 6 inches away from the body at that level 1. So it is only when that 10 minutes exhausts that the machine goes off. When the 10 minutes exhausts, the machine goes off. That is what I was telling you about pulse wave radiation. That is what we call pulse wave. At that time, the wave stops. When you on it again, when you place your hand again, it does not automatically start by itself. You on it again. So by the time it goes off, it has reset itself. It has reset itself. So by the time you on it again, it starts again. The wave starts again. So the advantage of pulse wave radiation is very, very unlike continuous wave radiation. The advantage of pulse wave radiation, the device will have a chance to reset itself and take it to status quo. Are you getting it? It's just like a brain burst of a car. When you put the car, automatically put the car as park and you stop park. At that time, the car is at park. It has reset itself because it's not moving. It's not working. And when you start, you go to drive, and when you drive normally because it has reset itself, the car starts starting again from the beginning. That's how the device is. That's a pulse wave radiation. So when it stops, it starts. So if you increase the level to level 2, the rate at which the radiation comes out will increase. And the air that is coming to your body, the quantum energy that is touching your body will become warmer. When you increase it to level 3, it will become warmer. Are you getting it? So when you see that it is warmer, you increase the distance a little away from the body. You no longer maintain 6 inch. You now increase it to maybe like 8 or 9 inch away from the body. When you say 6 inch, we're talking about 12 cm from the body. So you increase it to like 15 cm if you increase the level. But most especially, we advise leave it at that level 1. Use it at that level 1, maintain that 6 inch. When you exhaust the 10 minutes on again, you can preferentially increase the timing. You can take the timing to 20 minutes while it's still on level 1. So if it is only when it gets to that 20 minutes before you can switch off. It is the timing that you program it. So they have given us, they are giving us a 40 minutes timing duration that you can place that device on 10 minutes, you can place it on 20 minutes, you can place it on 30 minutes, you can also place it on 40 minutes at level 1, at level 2, at level 3, at level 4. So it's very interesting. So that means you can attend to several people with that. So if you time it at 20 minutes and you want to use it 5 minutes for each person, you see that you're able to attend to 4 persons within that 20 minutes before it exhausts. Then you put it on again, you want to attend to another 4 persons. So you can see within a space of 1 hour, you have been able to attend to about 8 to 10 persons. So that is the mode of operation. And then the duration, you can use it as long as the 3 minutes that was prescribed by the company. You can also extend to 5 minutes, and you can also extend to 10 minutes. Depends on the disease condition, how severe and how chronic it is. So if it is for normal prevention, you don't want to use it to galvanize your immune system, to build your cells, to build your nerve function, you can beam it 3 minutes all through the meridian points. But if it's for treatment, there are some cases you go for 5 minutes. Like arthritis, if there's a space for arthritis in a particular part of the body, you can beam it for 5 minutes twice daily. Beam it in the morning, 10 minutes or 5 minutes. In the evening, you can also do it 10 minutes or 5 minutes. Yes, twice daily. So we can use this device twice daily, and we can also prescribe 90-day duration as our normal Superlife product. So yes, we can also prescribe. So no prescription should be less than a month. If you are using it for for management of disease or for treatment of disease, it should not be less than a month. As we are using it with existing Superlife product. Are you getting it? So that is how we also use the machine. So it can be used with our product. It can, you can also minimize. You can also prescribe it the way you prescribe Superlife product twice daily. 3 months, 2 months, 1 month, but it should not be less than 1 month. So users should not just concentrate on using this one, because this device can give you a one-off healing effect. You can just come with pain in any part of your body, and it is used for 10 minutes for you. That pain may disappear instantly. But you should not stop there. You should not just give that single treatment and say that person has been made, that solution has been provided. No. You have to tell the person to, subject himself again to several days, at least a month, so that solution will be guaranteed, so that the function will be guaranteed. So that is how it is used. Now, lastly, I want to mention to you, Dollar King has said the second edition of the manual is coming. Yes, the manual is almost ready, the second edition, and this terahertz has been included. Terahertz has been included in each of the prescription. Terahertz water. Terahertz water. Yes, I just remember now. we can energize water with our terahertz device. Put water in a vessel and you beam it 10 minutes or even 15 minutes or 20 minutes to have terahertz energized water. The advantage of that water is that the water contains hydrogen ions, the water contains oxygen ion, the water contains hydroxyl ion, and the water also contains terahertz itself radiation in the water. Have you seen it? So you have about 3 ionic components and the electromagnetic radiation component in the water that you have just energized by terahertz. So such water now is, the bond that is holding water molecules together is called hydrogen bond. So when you subject terahertz, that water to this terahertz, it will break the bond. And when you break the bond, it has increased the kinetic energy. So that means the water molecules are vibrating faster, the hydrogen ion moving faster, the oxygen ion moving faster. So when you take such water, it penetrates faster into the cells because it has high kinetic energy as at that time. And it also have terahertz radiation energy as at that time. So you see that, so we can also use that water as, prevention. We can also use that water even as we're taking treatment, give it in place of alkaline water, we use that water. 400 mils, we can take it 400 mils in the morning, 400 mils in the evening. It's so powerful, so powerful, so powerful. So, for your information, our new Superlife manual that is coming, there's terahertz in each prescription. There is a terahertz energized water in the prescription, and several other disease conditions will be added. And there is a footnote to say similar symptoms, similar signs should use a similar product, similar application, and similar prescription. So I think we will stop there for today. I just believe that web with this lecture, Superlife Terra, we have seen the role of functional medicine, and Superlife Terra device one is playing a very fantastic role in dealing with the challenges of orthodox medicine, dealing with the challenges of other devices that could not, that are not revolutionary like this. So thank you very much, and God bless you for listening. Thanks, and God bless.
Thank